So here is our main home shrine.
During Diwali this weekend, the Patel family stayed safe, attending temple online.
We are missing our friends, but yes, with technology, we are good.
It was a different story at two outdoor events in Ontario this weekend, shut down by police. A scenario doctors behind a Toronto Star opinion piece were hoping to avoid by shedding light on the transmission of COVID-19 in the South Asian community. Zain Chagla is one of those doctors.
In Brampton and Peel region, we talk about 30% of the population being South Asian, but nearly 50% of the cases being South Asian.
He says it's happening across the country, so he calls on South Asian Canadians to protect the multi-generations living in one home and to avoid having guests and to realize they're at special risk.
This is a very forward-facing community, that there are a lot of public jobs and ones where people are getting repeated exposures.
This emergency room doctor also wants to address the lack of accessible information on COVID-19 safety measures.
So I think we need increased messaging in different languages.
So online, as part of the newly formed Seek COVID Task Force, her team is offering how-tos in English, Punjabi, and Hindi.
How to take precautions, how to isolate, how to take the screening test if you think you have symptoms and you think you need to get tested.
This head of a South Asian group wants to make sure that all this talk won't lead to blame.
You're blaming the victim of hardworking, tax-paying individuals who have been cheated of the resources that they need in order to combat disease and ill health in general, but this pandemic in particular.
He says long-term underfunding of public health has put racialized communities at risk, and that needs to be addressed. Magda Gebrselassie, CBC News, Toronto.